not true. It's only for carers and senior carers. But if you're recruiting teachers, we talked about education provision, if you are recruiting qualified youth workers, if you're recruiting accountants, if you're recruiting people in other categories, you can still recruit them from abroad. No one said you can't, but it's just the carers. And the carers, it was open because the qualification bar was so low, so anyone could come. But it doesn't mean that recruitment has been stopped for everybody. So it's important to note that. So with the hubs, please make sure that you join, you sign up. Please make sure that you just go through the motions and interview the staff. If you can't recruit them, then explain why and keep a record. So now what the Home Office is doing is they're routinely refusing marriage applications. They're just refusing them. Even if you produce a marriage certificate, they say it's not even worth the piece of paper that it's on. They say it's not proof that you are married. So when people came into this country, on top of the fake marriages, they also then divorced each other, even if just because they've arrived, or they brought husbands so that the children could come, or brought wives so that the children could come, but they were not together, and that's caused so much cases of domestic violence, people being removed off the visas, because I think when that button was discovered, that I can remove you. And all of that data is then analyzed. And in some of the meetings we have with the police, they're talking about the increase in cases of domestic violence, the reports to the police. Social services in Coventry, they're inundated with children coming into care because of the domestic violence in the homes. Maternity services, the sexual health, they're saying it's just too much. So all the departments talk, they have meetings with the Home Office, and they tell them the issues on the ground. When I was sitting in that meeting, I wanted to hide because I was so embarrassed. Because the issues that people think they're clever because they will talk about it on social media, but the police can see. So it's now, that's why they've said no dependents. And can you blame them? And so the rules have tightened so much because of the abuse of the system. So now, because of this abuse, even genuine people who are trying to bring their spouses, it's become so difficult. And going forward, I don't think they would ever introduce the care work visa with dependents again. Because you know what happens with the British, I've seen that if they trust you, they'll give you, they'll be fine. But you take advantage of that and they come down hard. So this obviously impacts sponsors because they'll lose, people may not want to come here without their dependents. No one wants to come. So the numbers have decreased by 91%. And it's going to cause shortages in the sector. And the white paper proposals, I'm not going to go into that in detail. I'll probably share a webinar that we did on that because we went into that in quite a lot of detail so that we can share that. But at the moment, for sponsors, what I would say for those who hold licenses, check your records, show that you're trying to recruit local talent, have perhaps training schemes for young people and youth where you're trying to get apprentices or trying to encourage young people into care. Show at least the efforts that you're making. Keep your training records, your recruitment records, have compliance audits. It's better to pay for a compliance audit than to pay when you've lost your license and lost your staff. Prepare for more changes. I think the government is responding to the issues and they're implementing policy as they go. The right to work scheme is changing. That's just the last thing that I wanted just to highlight for people. If you're recruiting agency staff, so when you recruit agency staff, because with the shortages that are going to come because of the limitations, some employers they recruit agency staff, or they work in collaboration with other people who've got sponsored workers and they come and work for you. But the right to work scheme is changing, where now if someone is self-employed or if they work for an agency, you still have responsibility for their right to work checks. So if you're having labor provided to you by someone else, you still have to make sure that all of those workers have the right to work. So those are new right to work checks that are going to come into play. So please keep an eye out for that, and we'll do some more webinars on that as well, so that you just stay up to date. Stay up to date. There's no excuse. Ignorance is not an excuse. So you need to know what is happening. So these proposed changes, I'll finish on these ones. So the importance of checking that people have a right to work is that if you are found to be employing illegal workers, you get a fine which is increased to 60,000, but also your license can be revoked because of that. So where you're using agency workers, or you're using, or you're feeling sorry for people, or you are just saying just work more than 20 hours because you feel so, people come with their stories. Please don't feel sorry for people, because they will always come with their stories, and those are the same people who will report you. So if you're caught, the impact is too devastating, and we won't be able to help you. Shupi is here. Shupi will be able to save people who breach the rules. Shupi is a solicitor. We've got Caroline there as well, who will come and rescue you when you are now going to prison. So I'm constantly referring to her, all the criminal cases, but we won't be able to help where you've just breached the law, and you know, because you're feeling sorry for someone, you employ someone who doesn't have a right to work. So please make sure that you comply with all your right to work checks. Yeah, what we offer is just we offer sponsor audits, HR training, policy briefings, take responsibility for compliance for yourselves and for your teams, just to make sure that you are proactive and you stay compliant. Where the changes have been made, my brother over there said he didn't know about the hubs, but it's you have to stay on top of it and read the UKVI website, make that your friend, follow our page on our website www.tulia.org.uk. We constantly put updates on there. We try and summarize them and make them user friendly. Look out for any webinars, and we're having a conference in August, on the 29th of August, for healthcare workers, helping them with integration, employment law, giving them the opportunity to just celebrate themselves, because we've got many amazing positive outcomes from this whole visa scheme. So we're using this day just to celebrate, and we are having the mayor and our local partners, the council, Unison, just to come and see the positive side of the healthcare worker visa scheme. There are over 120 who registered. We're sold out. So this will just be a day of celebrating. If you'd like to come and exhibit, if you're an employer who's looking to recruit displaced workers, we've got really good displaced workers in Coventry, because they're well trained, they speak English and they can drive. So if you come to Coventry, you can get them. So you're all invited to this conference. So if someone comes in to work for you and they are off sick for a long period of time, but you know that they're working somewhere else, so you should insist on their sick notes. And then if they continue having sick notes, have your own occupational health assessments. So Doc is here. I think we've referred some sponsors to him, to Dr. Chireka, to ask him to do, if you don't have your own private doctor, you can get your own doctor to do an occupational health assessment according to your policy and assess whether or not they are really sick. If they're working and they're getting paid, if it's not cash and they're actually getting paid and paying tax, that again is fraud, because they'll be getting statutory sick pay. I would alert the authorities as well. And if you are aware of it and you've got evidence of it that they're working, then you also have to go through your disciplinary procedure and then dismiss them. So follow your procedures all the time. You can't just say because you think that they're working somewhere else, or you say to them, I'm going to deduct the money because you're sick. You have to follow all the procedures that you have in place, because those procedures that you have, the sickness policy, your occupational health assessments, all of that is to protect you and the staff members. So there are staff members who who really take advantage. So for you, go through all the steps and make sure that you cover yourself, because they can then say you're discriminating if they've got, if maybe they're pregnant, if they've got mental health. Make sure that they don't have any protected characteristics that they can use against you, but follow the law to the letter of the law, document everything, and then manage them out as soon as you can. All right.